Lovely to see everyone here. Just a quick overview of the ARC that will be starting on the 1st of April next year. On the screen, you can see the challenges that we are all facing as a country and particularly as a city region. And these are the challenges that motivated our application for the next ARC. So very stark inequalities within Greater Manchester, between Greater Manchester and the rest of England. We know about the terrible pressures on the NHS and social care, and many of you in the room know far more about that, far more starkly than I do at the moment. We all are getting our heads around how we support and help the 3 shifts announced in the NHS in the 10-year plan, from sickness to prevention, from hospital to community, and the other one that I knew would go out of my head. What's the other one? What's the third? Analog to digital. Yeah, I knew that. That's not what happened. We hear a lot about, particularly from our stakeholders sometimes, that the pace of research and innovation is really slow. And that, you know, if somebody comes to us and says, can you work with us on evaluating X? There is often a presumption that that's going to take a very, very long time. And by the time we've done it, X will now be defunct and we're working with Y. So we want to change that and become a lot more agile and responsive and do more rapid evaluation. So we want to deal with the slow pace, speed things up. And we also want to play our part in speeding the extent and pace of the uptake of proven innovation into the NHS and social care. So there's a lot of challenges. We're trying to, excuse me, try not to cough into the microphone, work with them all. Okay, so thinking about the city region in which our ARC is embedded, and this is one of the slides we used at the interview for this ARC, and we talked about a core 40. You'll all be very familiar with the core 20+5 phenomenon, where 20% of the population lives in the most deprived areas. But in Greater Manchester, that percentage is 40%. So we called it the core 40. In some areas, it's much worse, yeah. So we've designed our themes as a direct response to that, and I'll talk about those a bit more in a second. But this slide is also there to emphasise partnership. Yes, the University of Manchester. Yes, the other universities in Greater Manchester with whom we work and want to work more. We've got the Health Innovation Network, which is a national network of organisations trying to speed the uptake of proven innovation across England. We have our own in Greater Manchester called Health Innovation Manchester. We want to work with them. We want to work with the extensive NIHR infrastructure in Greater Manchester. We probably have at least as much, if not more, than most other places. And we want to do more collaboration with industry. Again, that's going to help that innovation piece. And we want to work much more nationally with the other ARCs on tackling national problems. And there is going to be a national ARC network. So the picture is changing. The picture of the way the current ARC works is changing to the next ARC. So these are our strategic aims and themes for the next ARC. But fundamentally, we want to foster a vibrant and inclusive research culture that produces timely, needs-driven, transformative health and care research for the benefit of the people locally and nationally. And so our themes have been designed to address those challenges, that big challenge. So our first theme, strengthening communities, is aiming to study and understand how we better enable communities to be stronger, to do that prevention, sickness to prevention shift, to reduce health inequalities. Aim 2, to drive prevention and early intervention, does what it says there really. And that's the kind of research that we haven't done as much of in this ARC, so that'll be really exciting. Pete Bauer, who's here, is leading that theme in the next ARC. Caroline, who's also here, I think, is leading the first theme. Caroline Sanders, sorry. Have I seen Caroline Sanders, or have I dreamt that? I've hallucinated Caroline. The third aim is to contribute to economic growth. We all need that as a country. There is a big connection with health and economic productivity. And so the third theme is work, health and productivity. And Luke Mumford, who's over there, is leading that theme. And then the fourth strategic aim is to support the delivery and economic sustainability of care. And that we've set up a theme specifically for that, looking at how the relationship between demand for health, how we channel resources to maximise people's health, reduce inequalities and so on. And then the cross-cutting themes of evidence generation and synthesis, which is a lot about evaluation, a lot about producing evidence synthesis to inform decision making, and the theme of implementation and knowledge mobilisation, which is quite clear. But where's capacity development, I hear you all ask? So we've got enabling strategies. So we've designed this arc a little bit differently, and we have these 4 enabling strategies that should be everywhere, that should be hardwired into all our activity. And that includes patient and public involvement and engagement and research inclusion, so that the people that we are involving in our research, whether they are participants or whether they are our staff, should be representative of our community. We've got research capacity development, we've got knowledge mobilisation, how do we get the products of our research out there and used, and prioritising partnerships. Partnerships is going to be a really, really important part of the next arc, as it has been for this arc. So I'm not going to dwell on this governance slide, but the thing I wanted to draw attention to that is really different about this arc, I won't use the pointer, but in the middle, the second bit down, the Greater Manchester Partnership Board. We are setting up a partnership board which we haven't really had quite in this format, in this arc, which will meet 6 monthly, which will be chaired by the Chief Medical Officer for NHS Greater Manchester, Manisha Kumar, and that will be very much about aligning what we do with regional priorities as well as national priorities. So that's the main thing I wanted to emphasise on that. We want to be responsive and do the research that's needed. And then my final slide, because I don't want to go over time, and if I can leave a bit extra, is this is what we want to achieve. All of that should lead to this. We want an impact of our work to be that co-production is embedded in everything we do, and the value of research we want it to be recognised beyond the realms of academia. We want research to be business as usual in the NHS and social care in Greater Manchester, not some esoteric thing that you do for a qualification. We want it to be the norm, and we want people to be able to see the benefit of that. We want to have enabled the 3 shifts we talked about before, including digital to analogue, analogue to digital. You see, I can't even get it the right way round when I remember to say it. We want to be able to point to ways in which we have improved health and reduced inequalities. That's not going to be all on us, obviously, but our contribution to the system has enabled that to happen. We want to be able to point to the ways in which we've contributed to understanding and reducing economic inactivity and increased productivity. Again, it has to be in partnership. We want to be able to show that we have definitely contributed to more rapid translation of proven innovation and uptake into services and care. We should definitely be able to point to the way that people from underrepresented groups are more involved in our research. We want to see more rapid evaluation, leading to accelerated uptake of proven innovation, better health and productivity, reduce costs and reduce demand for care. Again, not all us, but we want to play our part in helping the system make that happen. And very finally, but absolutely not least, all of that depends on increasing the capacity for doing more high quality research in health and social care in areas of priority. And that is why today is such an important event, and I'm really, really looking forward to hearing about everything that's been going on.